World Health Day is a global health awareness day celebrated every year on the 7th of April. Amidst the increase in costs of living and healthcare landscape that are undergoing considerable reform, people have to seek other ways to take care of their health. One such is a holistic approach that focuses on the few trends and technologies that are shaping the future wellness, such as sleeping, eating, breathing, moving and connecting. Well, on Zoom to tell us more about this, we're joined on Zoom by Márcia Eugenio, head of Multiply Incentivized Wellness for Momentum Health Solutions, along with nutritionist Mbali Mapholi to discuss the future of wellness. Ladies, a very good morning to you. Warm welcome to Morning Live. Mbali, I want to start with you. What do we mean when we speak about holistic health? What does that entail?
That means holistic health means that we are just not focusing on means to lose weight or on ways for eating for weight purposes, but we are focusing on ways for eating, ways of living, lifestyle modifications, lifestyle changes that are going to support us to live well, to prevent diseases and to manage diseases. So holistic health is about that. It's about just not only looking into how we are, the physical appearance, how we look, but also how we feel, how are our emotions, and how are we thriving, are we able to wake up and get up and go, all of those things. So it's about all pillars of health, physical health, the emotions that we have, but also just the disease prevention and management as well.
Márcia, tell us about, Multiply's repositioning its latest offering and what it means for the health space and, for the ordinary man on the street. What does this mean?
Yes, Lebo. So Momentum Health Solutions really believes that incentivized wellness programs such as the new Multiply is really important for the sustainability of funding healthcare because they can lead to less health events and reduce healthcare costs over time. But what's really important about that is equity and access to these programs so that people from all walks of life have access to it. And we believe that by promoting healthy behaviors in a way that's relevant to you, such as regular exercise, for instance, as Mbali said, but more than that, we are focusing on physical and mental and social well-being. We believe that by focusing on all of those holistically, they can really lead to better health. And even if you do already have an emerging chronic condition or a chronic condition for a couple of years, such as diabetes or heart disease, we know that by focusing on physical, mental, and social well-being, you're more likely to be more successful in achieving better health. So these are the major drivers for healthcare costs. And that's why we, as a healthcare business, funding healthcare, we believe that this also leads to managing or reducing the overutilization of healthcare services. And this is really important for us because it means that by doing so, we are able to deliver more health for more people for less. So ultimately, it improves the sustainability of funding healthcare over time.
Mm-hmm. Mbali, what do you believe is the general view or attitude, from South Africans towards nutrition in today's age, as well as from a cultural perspective?
We're seeing a big shift, and I think it's thanks to social media and people being exposed to different expert opinions from all over the world. We're seeing more and more people, going for the health at every size approach, non-diet approach, going more for focused on body positivity. This has resulted in, the reduction in we see that there is a reduction in consumption of your cultural foods that we love, like your sorghum. We see more and more people also eating more red meat. So there is that positive side of things that the exposure to trends has given people, which is focusing on body positivity. But on the other side, there is an increase in alcohol consumption and a decrease in consumption of these cultural foods, increase in takeout and less home-cooked meals. So there are those two things that are happening, but essentially it seems as if we're going somewhere, we're getting somewhere. The general view and attitude is changing a bit. People are more focusing on now holistic approach into health, but there's still more work to be done now to change the eating habits and say, let's take you back to the traditional ways of eating, because that we know from the research that helps a lot in terms of reducing disease prevalence, but also just overall disease management, whether it's type 2 diabetes, hypertension and strokes, and heart-related diseases as well.
Marsha, is that one of the considerations that you took that includes holistic health when you're drawing up this new project?
Absolutely. So it's really about making it relevant for South Africans and really shifting away from rewarding product loyalty to rewarding good health, but also rewarding people on their journey to good health. So traditional loyalty programs, there are hoops that you have to jump through, and after 3 or 4 or 5 years, you're able to get there and earn certain rewards. What we would like to do is to really become a partner in a member's journey on their journey to well-being. So every incremental step they take to living a healthier life, whether it's by prevention screening and understanding what your risks are, knowing what to do about it, and actually taking the action and achieving those goals towards moving towards that, we want to reward that. But ultimately, we believe that through a program like this, we can create a culture of South Africans taking more accountability for their health. And that applies to whether you're young and healthy, whether you are a bit older and may already be experiencing some health conditions. That's really important for us. The relevance is really the key focus of our new program for all South Africans from all walks of life.
Mbali, are we changing the narrative in terms of, there is that myth that healthy food is expensive, and we're seeing a shift, though, in the market. Are you also seeing a shift where, people are moving towards healthy food because it does not necessarily mean that it's more expensive?
Yes, we are starting to see a shift, and I think such conversations are contributing positively to that. Healthy eating should not be expensive, and is not expensive. The thing that makes healthy eating expensive is that we try and do foods that we don't enjoy or eat foods that we are not familiar with, and because we are thinking, just because these foods are eaten in other parts of the world, they are relevant to us. But when we try to move and say, okay, what do I enjoy? What foods do I enjoy? And add those foods that you enjoy. For example, culturally acceptable foods for you. And then you start to realize that actually adding umroho, the green leafy vegetables that we're used to, is actually very healthy, and those foods are nutritious. You don't have to eat asparagus to try and chase good health. So those sort of shifts and education is helping consumers realize that healthy eating is not about foods that are labeled fancy words and gluten-free, but healthy eating is about finding nourishing foods that are packed with nutrients, and looking to your surrounding, buying local produce, buying what's in season. That makes healthy eating much, much more affordable as opposed to buying the foods that we're not familiar with.
All right, ladies, thank you so much for talking to us. Márcia Eugenio from Momentum, as well as Mbali Mapholi. She is a nutritionist, speaking to us about the future of wellness.